Hello, everyone. I'm Scott Chelson, and this is the Disruptive Front. Today is show number 1, and to launch the brand, I wanted to bring on somebody super innovative, super forward-thinking, and I have a very special guest, Scott Knoer, Executive Vice President and CEO of APhA. Scott, thank you so much for joining me today.
Fantastic, Scott. I'm thrilled to be here, and how could I say no to someone named Scott K?
Hey, we say it all the time, Scott squared, and I appreciate your friendship and the relationship we have, but I really do appreciate you jumping into what I would call the head of pharmacy and at the table with healthcare leaders. So thank you so much for taking on that role, and I couldn't think of somebody better to take on that position. So I really do commend you.
Excited to be here. There's a lot of work to do, but excited to be here.
Well, this show is about healthcare, innovation, technology, policy, and really what's in healthcare. And I wanted to bring you on to show number 1 because I felt like, you have such an insight coming from Cleveland Clinic and everything you've done over there. I want to talk to you a little bit about that. So to start things off, I want to jump in and not waste any time here. Let's talk about the hottest topic right now, which is coronavirus. I won't jump into the hydroxychloroquine or what studies. I won't talk about whether masks work or not because we know they do. I know that pharmacists and healthcare providers, we've been on the front lines. We've had people on the front lines when there was a ton of unknowns and not enough things, or resources or things to provide for our healthcare providers. Talk to me a little bit. What are we seeing now? Where do we need to be? And what's the absolute need?
Yeah, so I think one of the big needs we're seeing, Scott, and this is a healthcare show, not just pharmacy. Of course, I'm a pharmacist, so I'm going to look through that lens. But I think testing is a huge opportunity for us to continue to move forward. And, I don't want to get too much into policy, but that's a lot what we're trying to do here at APhA is let the government know that in order to dramatically expand testing, we need to have pharmacists be able to do it. And as you know, the reimbursement mechanisms for pharmacy are terrible. It's all about product really fast and PBMs and all the issues we've got. So we need to make sure that pharmacists are appropriately remunerated so that they can do that, because otherwise they aren't going to be able to, no matter how badly they want to help out. If they don't get paid for it and their pharmacy goes broke, they're not going to get it. So we need to get pharmacists paid to do all kinds of things to decrease overall healthcare costs and improve health outcomes for patients. COVID will have a real place, and I think the immediate place in testing, and then immunizations once we get a vaccine. Because as you know, right, 90% of the population lives within 5 miles of a pharmacy. We're the most accessible healthcare provider out there. We need to take advantage of that, and our pharmacists are ready to step up.
Well, and I want to actually talk to you a little bit about that. Some of the states, Ohio, New York, talk to me a little bit about some of the access to pharmacy. I know the New York Governor Cuomo just announced a big announcement to get pharmacists in front of vaccines once one is available, which I think we don't usually see, right? We usually see the other side where it's a reaction versus I don't know, let's coin a term, proaction here, because I think the idea is that we're trying to get ahead. What are your thoughts on something like that and some of the other states that you've seen?
Yeah, Scott, and that's fantastic. In Florida, right, you guys just passed, before COVID was really a big thing, a test and treat. So, hopefully that'll be able to help pharmacists here. Now, I've been at the Cleveland Clinic before I came here for the last 9 years, and I was really involved with the Ohio Pharmacists Association. I tell you what, Scott, I can look from my office. I got a beautiful office. I got the Lincoln Memorial right in front of me in Washington, but I can see the Capitol right there. If we could actually get anything done over there, I could throw a rock to the Capitol, but getting things done are incredibly complicated. But our states, oh my God, they run circles around the federal government. That doesn't mean we're not trying, and we're actually making inroads, okay? So Ohio, a few years ago, we passed a really good Collaborative Practice Act, and then boom, we have a provider status, okay? And it's not enough just to pass it. So what's that mean at the state level? Okay, the nirvana for pharmacists, as you know, is provider status for Medicare, because that's all 50 states, our biggest payer. Medicaid is run, as you know, by the states. So we can attack that state by state. So our strategy is fight national level, help our states at the state level, and Ohio is a great example. They passed it, and then nothing got done, okay? The Department of Medicaid did not create billing codes, so pharmacists couldn't bill. Guess what? The pharmacy patriots at the Ohio Pharmacists Association relentlessly were in the media. The Columbus Dispatch, which had that whole series on spread and PBMs, they got in the news, and the governor of Ohio, Mike DeWine, called Antonio Chacha and said, how can we get our pharmacists testing for COVID? He's like, we have provider status, get Medicaid to create billing codes. So now, because of advocacy at the state level, we're getting billing codes so pharmacists can provide that service in Ohio. And that's how we got to attack it. We'll get later into private insurance. But, so at APHA, fight at the state, or the national government, support the states, and then we'll talk a little bit later about going after private insurers and demonstrating our value.
And I think this is great, and I hope maybe part 2 of this is we can kind of a call to action to how people can actually get behind something like that. Yep. And maybe set a precedence when you go from state to state, like a template to be able to use. I know a lot of those talking points have been used in the past for things like collaborative practice, which I truly appreciate. I want to jump into the idea of telehealth. People have been using telehealth for the longest period of time. You've been using it for the longest period of time. I mean, we talked about it for so long, EICUs for many years. What are we looking at now? And why are pharmacists having barriers, or what limitations can we talk about there?
So Scott, this is, so COVID is a horrible thing. Last thing you or I wanted was a pandemic. But when you have something that impacts society so broadly, that often has positive benefits outside of my commute to work. And one of those is that we're finding, right, that people can work from home and they can do telehealth. So, I was at the Cleveland Clinic for 9.5 years, and we tried to roll out telehealth, but we had issues with getting paid for it, right? Insurance companies wouldn't pay for it. Now, okay, the barriers came down and they can get, so you couldn't even see a doctor unless you were like ready to die because we were building units, for COVID. Fortunately, we didn't have to open those up, but now there are billing mechanisms, so telehealth is going to take off. And the whole thing that's holding pharmacists back, again, it's being paid for those services, right? We can reach so many more patients if we have access to telehealth, and like everything else, we need to be incented because there's a lot to do. And unless we can pay the bills and keep our pharmacies open, we aren't going to do the things that we're trained to do and that we need to do.
Well, and doesn't this come back to that federal discussion you just had with me about how CMS is not really paying for those things when it comes to the Medicare? And that's, would you say, maybe why we need provider status as well? Like another thing, maybe the pandemic could be that silver lining in some capacity?
Absolutely. And, I think you and I were talking earlier about the CBO scoring. And, so when we tried to get a big law, had all the pharmacy organizations, so many senators and Congress people, both sides of the aisle. And the reason that didn't go forward is because the CBO, Congressional Budget Office, scored it. And I don't remember that we're going to have to pay pharmacists several $1 billion. Yeah, we're going to have to pay pharmacists, but we weren't allowed to count the offsets, okay? In hospitals, I hired all kinds of pharmacists, not for, bringing in revenue, but because they control costs, right? We use more cost-effective drugs. We don't have patients getting their feet cut off for diabetes because, we're managing their treatment. They're not being admitted to the ED with congestive heart failure because they're taking their medications right. So yes, we absolutely have to get pharmacist provider status. And we're looking, so the big nirvana is, so love audiologists and nurse midwives, love them to death. They're super important. They have provider status along with physicians and NPs, but pharmacists don't. It's ridiculous that we aren't recognized as providers so that we can, work at the top of interdisciplinary team, right? Doctors are quarterbacks. They need pharmacists and dietitians and all these people to be successful. And the federal government is limiting our ability to lower overall healthcare costs. Okay, right now we're having all kinds of issues, with the Black Lives Matter movement is really shining a light on these. COVID's the biggest example, far disproportionately impacting the African-American community. So we need to have pharmacists who are in these communities. We're a point of access, put us in, coach, let us do what we're trained to do as part of the interdisciplinary team.
Well, and I want to touch on that actually a little bit because I was really, really, really happy to see how many associations and organizations came together to make a stance right away on the racial discriminations and injustices. And, a lot of times, and maybe this is my consumerism, mindset here, is that a lot of times pharmacists are last to the voice around things around like this, like what we're talking about right now, because they're controversial or they're touch points and XYZ. I was so proud in that specific moment to see that come out. So I want to commend your organization and the others as well. But one things that stuck out very heavily to me were the disparities. And, pharmacists at a retail store, we know they don't get information like labs, work You know, we get, do you smoke, do you drink kind of thing. There's really no social determinants or information there. How can we truly help people out if we don't have that information? And I wanted to get your idea on that. How can we, convey or transfer our energy and our sources, to help with those disparities? Should we get a national database? What kind of things would help us, and where do you see us going?
Yeah, Scott, great questions. A couple of things. So I'm really proud of the coalition. You know, we're one part of the multiple pharmacy organizations, and Lakeisha over the National Pharmacists Association was a trailblazer, right? She sent an email out. We have meetings every week, and she was the first to say, hey, let's get together. And we got together as all of our organizations were, very happy to do that. And the next part of that is information. So Scott, my, working at the Cleveland Clinic, what set my community pharmacies apart from others were information, okay? All of my pharmacists had access to the comprehensive electronic health record. So I saw how beneficial that was, right? My pharmacists weren't in the dark. They could see, when did that patient have their last appointment? What are their latest labs, and what's their blood pressure, and not just seeing an old list of medications, but what is active in the profile. So yeah, we got a long way to go, but I've seen the light. That is absolutely the best way for pharmacists or any healthcare provider, right, to take care of patients. So I think working toward health records that pharmacists in the community have access to. Now there's lots of ways to start. If you're in Iowa City, Mike Brownlee's at University of Iowa, let's start working. Can we share that information? So I think academic medical centers are a great place to start, but that's got to be built, because we're just so much more effective with the whole picture.
Well, and I think as we move into like a pay for performance model, we're going to start to actually need some of that data and engage our patients more. And I think that comfort level and utilizing some of these resources like telehealth, and I have to say, getting our professionals comfortable, which again, we kind of hit back to the hitting on the head of pandemic here, is some of the silver lining is that people that were, let's say, not comfortable with online usage are now being forced to it and finding it that it's not as bad as they thought, right?
Absolutely.
I want to jump into some of the bills. We talked about price gouging, and one of the biggest issues, and I know people face this all the time, we got a big scare of, the Affordable Care Act and so on, but talk to me about some of the bills that have been proposed for price gouging during COVID.
Yeah, so there's price gouging, and this is something I was very passionate about before I got involved. And, there are a lot of issues, and it's complicated. And certainly I think, the manufacturers are part of that. PBMs are a huge part of that. So how do we go about, in order to bring prices down, we really have to have competition and transparency, right? So anytime you have a monopoly in any industry, you have higher prices. And in the case of some of the stuff we saw with Valiant, with their egregious price increases for nitroprusside back in 2015, is because they weren't technically a monopoly, but they were the only one making that drug, right? It starts when it's brand name, they get a lot of money, then lots of people start making it, the price drops, and then people stop making it. And then you got one company making it. And they're like, okay, we can raise the price 800, 5,000% with Daraprim, with PharmaBro. And we don't see a lot of that. We still see some of that egregious price increases. And part of the reason is a lot of us spoke out in the media. And Valiant, for instance, I like to think I had a little part in that. Their stock value, they lost hundreds of millions of dollars because of all the bad press they got, and they had to change their name to Bosch Pharmaceuticals. So there's certainly challenges. I think insulin is one that really is so easy to see, right? And we've got stories across the country where patients are rationing insulin and they're dying because they're not taking it. So we get, I haven't seen a bill that really solves the problem, but we got to, take some steps to continue to allow our manufacturers to innovate, because without the amazing drugs, we can cure hepatitis now, right? We couldn't do that 15 years ago. But it's a balance, right? It can't complete, new drugs, now they can cost hundreds of thousands of dollars, right? So CAR T, it's amazing, but what is it? $500,000, $600,000? I don't know exactly. So there has to be a balance and a societal impact on the things we're doing.
Well, and that's why I think, one of the call to actions from the organization and other organizations should be about voicing these things. You know, it's not just about the organization coming out with a press conference, but it's every pharmacist, every healthcare professional as a whole, because it doesn't matter if you're the nurse or you're the physician, you can't follow up if that person's not taking their medication. It doesn't matter if they can't afford it.
Yep.
If they're not going to take it, what does the treatment matter? What is the treatment plan? What the plan doesn't even exist anymore.
Yep.
So I think that everybody needs to get behind this, and we need to, you know, really impact our communities with knowledge, because let's be honest, insurance is very confusing, whether you have select or premium or, you know, advantage. People are very confused, and it's about deductibles and all this stuff. So that's already enough. You know, the prior authorization for physicians, that's already enough. So I'm really happy to see that a bill is being put forth to start to have accountability on some of these things and ensure that our taxpayer dollars are not just being spent on some CEO, sorry to say that, some CEO salary during all of this, because we need to be here for our patients. And I'm so happy that the organization, which does represent the professionals, is more worried, focused, and worried about the outcomes of our patients, because without them, there is none of us. Absolutely. And so I really appreciate that. I want to ask you, as the CEO, as the executive vice president, I want to know, what is your call to action, first to the pharmacy world, we'll start there, and then to the communities that we live in?
Well, to us, okay, so we can't do it alone. APhA, I think there's been a perception that, you know, APhA represents all pharmacists. And sometimes if you represent everybody, you don't really dig in hard and represent anybody the way you need to. So there's been a perception, I'll just be honest, that APhA is, you know, maybe scared, a little timid to take tough stances, right? Well, there's some new leadership here. We're not scared to take tough stances. APhA is going to fight and we're going to drive, but we can't do it without members, okay? We're a member organization, and sure, we have products and services and we have revenue, but members need to understand the value. And one of the things, quite frankly, Scott, is APhA has actually always done a lot of stuff, but they weren't very good at taking credit for it, okay? And it's marketing, right? If nobody knows, it didn't happen. So right now, we're fighting hard to get mini provider status for testing for COVID, right? So we're fighting the next stimulus bill. We tried to get in the last stimulus bill. If there's another stimulus bill, we're fighting hard to get that in. And we're working with our coalition, okay? So it's not just APhA. We got a great group of pharmacy organizations. All the CEOs get together every week to try to work together. So, you know, it's all, to me, we have to change the payment model, or pharmacy will not be successful in the future, right? We can't just get paid for how fast we can move prescriptions through. You saw that Ellen, was a Gabbard article, I might have mispronounced her name, in the New York Times about chaos in chain pharmacies. And that's nothing against chain pharmacies. It's the reimbursement mechanism, that volume is all that we're reimbursed for. If we're reimbursed for keeping your grandma out of the ER and you know, not having CHF, we can do that. But, you know, if we're not remunerated for that, you know, we can't be effective. So
well, we have to talk about reality, right?
Yeah.
We can sit here and be friends all day, but if we're not talking about reality, nothing actually gets done in reality. So I really appreciate it. What would you say to hey, let's say that the American people, and, you know, we're all facing hard times right now. What are your words to the American people?
Well, for that, you know, for society, for the government, it's put us in, Coach. Okay, we are the most highly trained people for medication, beyond dispute. Okay, physicians have generally more residency training. A lot of our pharmacists are residency trained too, but no one has more pharmacology, and no one understands medications and interactions better than the pharmacist. We're there. We're in every community. We're, you know, 90% of the population is within 5 miles of pharmacy. Put us in, Coach. Okay, let us do what we're trained to do. Let us bring down overall healthcare costs. Let us improve any kind of quality metric that you can do. But for God's sake, you know, reimburse us in a way that incents us to do that. So that's, for society, it's like, we're here. We got problems. You got problem solvers, right? You and me, the pharmacy, we have got, you know, society has to understand the value that we have, and they need to be fighting for us. Okay, so pharmacists, APhA is fighting for you. Society, you know, fight for pharmacy. Okay, you know, work with your legislators and work with your local pharmacists to make sure we have a model that's sustainable, so we can achieve our potential. And our potential isn't for pharmacists. Our potential is for patients.
Well, Scott, I'm pumped. And I have goosebumps right now. I can tell you that I'm so happy to have you as a leader. You know, we have to, like you had said before when we had a conversation, we have to adapt to technology. We have to own the space and not be owned by it. We have to start talking reality. We have to start talking facts. We have to be a part of these legislative pieces and ensure we understand not just the title, but really what it does to us and the unintended effects as well, and how it affects different communities. I really appreciate this. Scott, where can people find you if they want to connect or communicate with you?
Absolutely. Well, I'm all over LinkedIn. Also, my email, sknoer@aphanet.org. Love to connect with folks. Anyone in the media, we love to do interviews. We got to get the word out, Scott, that pharmacy, we're here, we're ready, we're dying to get in the game more than we are. A lot of us are, right? We're doing incredible things in all kinds of practice settings, but we're underutilized and we can make a huge difference.
Well, guys, this is the Disruptive Front. I am so happy to close out show number 1 with you, Scott Knoer. I really do appreciate it, and I look forward to part 2 with you if you could commit to that to me. And I look forward to some more updates. So thank you so much for coming on today.
Thanks so much, Scott, for giving us the forum. And here's a shameless plug. Can't do it without you. Join APhA. We got your back. You have to have ours. We're going to kick butt. We need members. We need active members to work together to fight for pharmacy. Thanks, Scott.
Thank you so much. I hope you have a great day, and have a great day, everyone. Thank you for joining.